Why do you have ankle pain while walking? All through here, in the back, on the inside, we're gonna go over all the best tips and tricks, and we're starting now. When walking, there's 4 major causes of ankle pain that I see. This is your anterior muscle group. So your tibialis anterior and your extensor digitorum longus and your extensor hallucis longus. These are the muscles that lift up your leg. If your hamstring's tighter, if your back's tighter, if your calf's tighter, these muscles have to work really hard to lift your foot. Sometimes people can get really sore in the front of their ankle, but probably the least common is on the outside of the ankle. Right here, you have muscles called your peroneus longus and your peroneus brevis muscles. They're responsible for turning your foot out. So basically when your foot turns out, that's your peroneus brevis muscles. These ones can get strained quite a bit, especially pushing off and out. I had a patient who was pushing a garbage bin up a ramp every day. It got really sore. This can get inflamed. Peroneus longus and brevis tendonitis, very common. Number 3, we're starting to get into the more common ones now, is in the back of the ankle. Right here, you can see your Achilles tendon, which is probably the most famous one, but if it's at the bottom, you can get Achilles tendon insertional tendonitis, or if it's in the middle, this whole chunk right here, it's said to be about 2 to 6 centimeters from your heel. That's called the watershed area of the Achilles tendon. So that's regular Achilles tendonitis. Then you can actually get the calf muscle. Deeper to that, you also have your flexor hallucis longus muscle and your flexor digitorum longus muscle. That actually helps bend your toes down. The muscle down to your toes is actually up here. And you also have your soleus muscle, which could get sore. Then the most common problems around your ankle are the inside of your ankle. On the inside right here, you can have your posterior tibial tendon. This is called your shin splints or posterior tibial tendonitis. So shin splints are very common on the inside of the ankle. Probably the most common, especially younger runners hitting puberty, running on harder surfaces, or along the bottom of your heel. The tendon also continues down here. You can also have a plantar fasciitis. So you can see all these muscles right here on the bottom of the foot, that's your plantar fascia. It's actually a ligament, it's not a muscle. Also on the inside, if your foot's going numb, spasming, you can have your posterior tibial nerve, which is called tarsal tunnel syndrome. It's kind of like carpal tunnel in your wrist, but it's in your foot. Those are the most common problems. I have specific guides for all of these conditions. Check those down below. But now, there's going to be a link for the top 10 home treatments that you can start doing right now that will take care of all these problems all at once. It works extremely well, and it's things you can start doing at home. Check this out right now.